morning, everybody. Welcome to the ARTA and the ARTA Benefit Plans presentation. My name is Jennifer Hope, and I'm the Director of Marketing at ARTA. And today I'm going to talk to you a little bit about ARTA, the ARTA Benefit Plans, how to apply all of that good stuff. Also, we will be recording this session. So to ensure your privacy, we have disabled your microphones and videos. But if you have any questions throughout this presentation, please use the Q&A function in Zoom, and I'll answer it as we go on, or I'll wait till the end to answer the question. There aren't too many people here today, so I will monitor the Q&A function for the entire presentation, but again, at the end, I will leave some time for questions as well. So let's get started. First of all, some people get confused why the Alberta Retired Teachers Association is presenting to them and they see that word teacher. We do have our public and private sector, which is where our Government of Alberta employees kind of fit into ARTA. So we do have teachers, we have our education sector. And our education sector are for teachers who have contributed to the ATRF for 5 or more years. And our public sector are for members who are vested in or in receipt of a government-sponsored pension plan, so LAPP, PSPP, MEPP. We also have a private sector where we have different groups that hold the same type of insurance risk as a retired teacher would. And these groups have their own set of eligibility requirements. So we are all ARTA. We're not just for teachers. We are for many different groups. So, and all of these groups have been vetted by our Health Benefits Committee as well as our Board of Directors. So that kind of leads me into eligibility. So there are some eligibility requirements that you need to meet before joining ARTA. So again, if you are, if you are vested to receive or are in receipt of a government-sponsored pension plan, you are eligible to join an ARTA Benefits Plan. Another eligibility requirement is you need to be an ARTA member. And then there is a fee to becoming an ARTA member. That fee for our public sector members is $50 a year. And if you do have ARTA benefits, that's $4.17 added onto your monthly premiums. There's no age restriction to joining ARTA. You can join ARTA at any age, and you can stay on your ARTA benefits plan until any age. Last I checked, our eldest member was over 100 years old. So they still are getting ARTA benefits. We do not terminate at any age. There are a lot of plans out there that will terminate you at, say, the age of 85 or 75. So just make sure you are looking at those termination ages when you are looking at a retirement benefits plan. You do need to be a Canadian resident covered by your provincial or territorial health insurance plan within your province or territory of residence. If you decide to retire in Alberta, but you decide that you want to move to BC, enjoy some warmer climates, maybe get out of these -40 winters, or maybe you have some family on the East Coast, you can do that. And your ARTA benefits plan will follow you when you move. You will not be terminated because you're moving out of the province of Alberta. Your ARTA benefits plan will work in the province that you move to. The only province where the ARTA benefits plan does not work is Quebec, as their provincial healthcare plan does not work in tandem with the ARTA benefits plan. Your eligible dependents can join ARTA, as well as your surviving spouse can continue on with their ARTA benefit. So if you are eligible to join ARTA today, and if something were to happen to you, your surviving spouse can join ARTA. Also, if you do join ARTA as the primary card holder and something were to happen to you, your surviving spouse can continue on with their ARTA benefits. We do not terminate surviving spouses when the primary card holder, if something were to happen to them. So just a bit of a background of our benefits plan. So the ARTA Benefits Plan was created by a group of retired teachers who wanted to create a benefits plan that was more conducive to a retiree's lifestyle. We all know retirees love to travel. You're no longer bounded by your vacation time. You don't have to travel during certain periods of time. Maybe your busy time at work is, when those low season prices are, but you can't travel because of work. You can now travel whenever you want. Therefore, the ARTA benefit plans, emergency travel coverage, is excellent. It's one of the best travel benefits there is in the country, as we don't have any stability clauses for pre-existing conditions. A lot of plans out there require that you're stable for 90 to I've even seen 365 days. And I'll go into our emergency travel coverage in full detail in a couple slides here. ARTA is also a not-for-profit organization, so any dollar that goes into ARTA goes back to administrating the plan, back to paying out claims, and ensuring we're offering our members the best possible benefits at the best possible premium. There's a lot of plans out there that will offer you a discount of, say, 10, 15% if you join during this certain period of time. We don't offer those discounts because we don't have those profit margins built into our monthly premiums. So I'm going to talk about the application procedure. So if you know that you are going to be retiring, you know you want to join ARTA, and you are going to be losing your employer-sponsored benefits, I typically tell people if you know you're going to join ARTA, apply within about 4 to 6 weeks before you retire, before you lose those employer-sponsored benefits. Because if you wait until 60 days after you lose your employer-sponsored benefits, so if you retire, you lose your employer-sponsored benefits, you're sitting on it, not quite sure what to do, and you get to say day 65 of not having benefits. With ARTA, if you want a plan that includes emergency travel coverage, you would need to fill out a medical questionnaire. And that medical questionnaire is administered by our emergency travel insurance partner, Beneva. And they're the ones that decide whether or not you can join an emergency travel coverage plan. But if you apply within that 60-day window of losing your employer-sponsored benefits, you don't need to fill out a questionnaire. So just get your application in early. It's easy to do. And the date that you indicate when you are losing your employer-sponsored benefits, your ARTA Benefits plan will start the day after. There's no waiting periods. You don't need to, sit and wait for 60 days before your benefit plans start. When you need your ARTA benefits, that is when your ARTA benefits will start. Sorry, I'm just going to go back to this for a second. If you are retiring, however, your spouse is continuing to work, you can stay on your spouse's employer-sponsored benefits, but when your spouse loses those benefits, make sure you apply within that 60 window of you or your spouse losing your employer-sponsored benefits. So I'm going to talk about the different plan options that we have available. We have sort of two buckets of plans. We have our comprehensive plans, which are available for our members who are under the age of 65. We know not everybody retires at the age of 65. So these plans, they include a little bit of everything. They have some higher prescription drug maximums, dental and emergency travel coverage. And our build your own plans, these plans allow members to kind of pick and choose what they want in a plan, whether they want travel, whether they want dental, and what prescription drug maximum they need. When you do turn 65 years old, you are eligible to join the Alberta Coverage for Seniors plan. And that Alberta Coverage for Seniors plan becomes the first payer in prescription drugs listed on the Alberta Drug Benefit list. There's hundreds and hundreds of them. And then ARTA becomes the second payer in prescription drugs. So your prescription maximum does stretch a really long way once you do turn 65. But first, I'm going to talk about our comprehensive plans. So because our members who are under the age of 65 aren't eligible for that coverage for seniors plan yet, these plans offer some higher prescription drug maximums. So within our comprehensive plans, we have 3 different levels of coverage. Core being the most basic, essential that middle of the road, and enhanced health being that higher plan with some higher maximums. All of our plans, our comprehensive plans, as well as our build your own plans, include single, couple, and family care coverage. So depending on your situation, you can have single, couple, or family. All of our benefit plans allow you to move up in coverage. So let's just say you decided to go to core health, and then maybe something happened, you need some higher annual maximum. You can always move up in coverage, but once you've moved up in coverage, you're locked in for 24 months. That's with all of our plans. So you can always move up, but once you've moved up, you are locked in for that 24 months. I'm just going to talk about a couple items that our comprehensive plans do cover. I would be here forever if I spoke about all the different benefits that are covered in an ARTA Benefits plan. I just wanted to highlight a couple like most popular items here, but know that our benefit plans cover many, many, many different benefits. So the overall coverage level with our comprehensive plans is 100% unless otherwise indicated. So that means when you submit a claim to the plan, and it's covered, you would be paid out at that 100%. The overall annual maximum ranges from $10,000 to $15,000. So what that just means is that's the maximum amount of money we'll pay back from claims that you submitted. So maybe you got your diabetic supplies, your prescription drugs, you got a wheelchair, you got private duty nursing, you got a CPAP machine. So that annual maximum is what we will pay out annually, up to a max. And your annual maximums do replenish on January 1st. So prescription drugs under our comprehensive plans are covered at 80%. You might not know how much money you've been spending on prescription drugs throughout your career because your benefit plan has been paying for those. So if you are on quite a few prescription drugs or just a couple of them, I typically suggest to people go to your pharmacist, ask them what you've been spending annually on prescription drugs. Then you can make an educated guess on which plan works best for you and your needs. Paramedical services are covered at 80%. So paramedical services are those practitioners that offer massage, chiro, physio, counseling, physiotherapy. ARTA covers 12 different practitioners, and our annual maximum is a little bit different from other plans. It is a combined annual maximum. So what that means is, let's say, for example, you had essential health, you have $1,000 a year to use on any practitioner that you want. So maybe you're someone who really likes massages. You can spend $800 on massage, but know that you have $200 left for any other practitioners. A lot of plans will give you $300 for massage, $300 for chiro, $300 for acupuncture, $300 for counseling, $300 for occupational therapists. You might not use all of those practitioners. So we want our members to be able to use that annual maximum on the practitioner that they need. Typically, our members only use 1.8 practitioners throughout the year. Diabetic supplies are a little bit different on the ARTA Benefits plan. It's a separate line item. So our members receive $1,750 a year to use on diabetic supplies. So this is great for our insulin-dependent diabetics. Comprehensive plans do include our 92-day emergency travel coverage with no stability clauses for pre-existing conditions. And you're also eligible for that supplemental travel coverage. And I will go into detail in this in a little bit here. So our comprehensive plans also include some dental care. So it offers 80% coverage for basic, preventative, and minor restorative work. And our enhanced health plan offers 50% coverage for major restorative work. So that those crowns, dentures, implants, onlays. Also with our enhanced plan, we offer 50% coverage for any orthodontic work up to a lifetime $2,000 lifetime maximum for any eligible dependents that do live at home. So to summarize, our comprehensive plans are available for members who are under the age of 65, and they include a little bit of everything. So extended health care, travel, and dental. So now I'm going to talk about our Build Your Own plan. So our Build Your Own plans, these plans were originally built to work directly in tandem with that Alberta Coverage for Seniors plan. So again, when you turn 65, you can join that Alberta Coverage for Seniors plan, and that plan becomes the first payer in prescription drugs, and then ARTA becomes the second payer in prescription drugs. So within our Build Your Own plans, you are required to choose an annual prescription drug maximum of either $1,200 or $2,000. So just know when you are 65, that prescription drug maximum stretches a really long way. However, you do not need to be 65 to join a Build Your Own plan. If you think one of these plans works best for you and your family and you're under the age of 65, that's great. You can choose one of our Build Your Own plans. So again, like mentioned before, our Build Your Own plans do kind of allow our members to choose what they want in a benefits plan. If you're someone who really likes to travel, our Total Health and Ultimate Health plans, these plans do include our 92-day emergency travel coverage. Or maybe you're someone who doesn't plan on traveling at all. So we have two plans that do not include emergency travel coverage, HealthWise, and HealthWise Plus. HealthWise Plus and Ultimate Health, these plans have some higher annual maximums for paramedical services, hearing aids, CPAP, and for vision, and also includes some coverage for defined lifestyle medications, so hair loss or erectile dysfunction drugs. Again, with our build your own plans, we cover many, many different benefits. Like as I mentioned before in our comprehensive plan, so an extensive list of medical aids and supplies, so power lift chairs, scooters, CPAP, vision care, hearing aids, many, many different things. But again, just highlighting a couple items on this page for you. So paramedical services for our build your own plans are also that annual combined maximum. Diabetic supplies are a separate line item as well. So build your own plans. You can join at any age, and allow you to sort of customize what you want in a plan. So with our build your own plans, dental is not included. So we have 3 standalone dental care plans as well. Option A, B, and C. Option A being the most comprehensive with 80% coverage for basic, preventative, and minor restorative work. And also option A offers 50% coverage for any major restorative work. Option C does include 65% for any basic, preventative, and minor restorative work. So now I'm going to talk about our emergency travel coverage. So if you are taking part in one of our plans that does include emergency travel coverage, either total health, ultimate health, or any of our 3 comprehensive plans, you're gaining access to some of the best emergency travel coverage there is in the country. I say that because we do not have any stability clauses for pre-existing conditions. Any emergency travel coverage expense must be considered sudden and unforeseen. So, for example, if you do have a prior condition, you go visit your doctor says, you can travel, I feel that you're healthy enough to go enjoy your trip. And if something were to happen because of that prior health condition, you would be covered for it because that would be considered sudden and unforeseen. There was no cause for concern for you to go on your trip because of your prior health condition. Or maybe you have a change in medication. Maybe your doctor deprescribes your dosage or increases your dosage. But after you visit your doctor, he says, no, you're well enough to travel. You should have no issues with this change in medication. Go on your trip, enjoy it, and if something were to happen, you would be covered for it because it would be considered sudden and unforeseen. A lot of plans say that if you're not stable for 90 days because of a change in your healthcare, because of a change in your medication, they wouldn't cover that for you because you wouldn't be within that 90 days. But we do not have those stability clauses with the ARTA emergency travel coverage. If something were to happen to you, you are covered for 100% of eligible expenses up to a $5 million lifetime maximum. And you are covered for any 92-day trips you take outside of your province of residence. Sometimes a lot of our members, we know they like to snowbird in places like Palm Springs, Phoenix, Vegas, wherever, and maybe not so much in the States right now. But we do offer supplemental travel coverage for any trips that are longer than 92 days. So you can purchase supplemental travel coverage in 15-day increments all the way up to 212 days. But what some of our members do, if they are somewhere like Vegas, they'll find a cheap flight back to their province of residence, hold on to proof that they did cross back into their province of residence, and then hop on a cheap flight back into the sunshine. That 92 days is an immediate reset as soon as you cross back into your province of residence. Another really great thing with the ARTA emergency travel coverage is we offer $10,000 per person per incident in trip cancellation and interruption insurance. So maybe you've booked a trip, you or your travel partner have fallen ill, maybe your home suffers a flood or a fire. Maybe there's some political unrest happening in the country that you're going to. We do offer that trip cancellation for up to $10,000. So you can book your trip and know that you have that cushion if something were to happen to you. We also have some really great additional resources for our ARTA Benefit Plan members. We have partnered with Green Shield Health, and Green Shield offers our members virtual physician services. So if you cannot get into your own doctor and you need, maybe you have strep throat, maybe you are, concerned about something and you want to talk to somebody right away, you can pick up the phone. A licensed Canadian physician will answer the phone. You can talk to them about what is going on with your health, and then they can also ultimately make you a prescription. So just a really great benefit for our members when you need to see a doctor right away. We also offer virtual health services and counseling. So all of our members receive 5 hours of free counseling as well as 5 hours of free couples counseling with Green Shield Health. Sorry, there is a question here that is kind of for everybody. If you sign up with a comprehensive plan, can you change to a build your own plan after you turn 65? Yes, and sorry, I forgot to mention that. If you start with one of our comprehensive plans, our member services team members will give you a call and say, hey, I noticed you're turning 65 in a week or two. It's now time for you to switch over to a build your own plan. So it's a very easy transition. You just need to check off which plan you would like and which annual prescription drug maximum you would like, and your comprehensive plan will turn you over into a build your own plan. So there is also another really great additional resource with your ARTA membership. We have a really great member discount program. So our member discount program offers we have well over 100 different partners that offer our members discounts to hotels, gyms, retail outlets, restaurants, airport parking. I've used my ARTA Perk discount program card many times and have saved quite a bit of money. So if you use your ARTA Perk member discount program card once or twice, your ARTA membership will have had paid for itself. So just another really great perk of being an ARTA member. We brought our ARTA discount program right in-house because we were finding a lot of those blanket discount programs weren't offering discounts that we thought that our members would need. So we contacted many different companies. We run this ourselves, and our members have been really happy with our discounts. So when you do join ARTA, we have a really great online benefits tool. So when you join ARTA, you become a MyARTA member, and then you can click on the MyARTA Health Hub. And this is a portal that will allow you to submit any claims you need to, check your coverage, see how much money you've left in all your different benefits. You can upload your receipts here if you need to submit a claim. The ARTA Benefits Plan does work with direct billing. So if your provider does do direct billing, your ARTA Benefits Plan will work with that provider and they can just do direct billing right at the office. However, maybe you need to buy a medical aid or supply, or maybe your provider doesn't do direct billing. This MyARTA Health Hub is where you can upload your receipts and you will be reimbursed within 24 to 48 hours as long as the claim is approved. So I know I gave you a lot of information today. We have a really great website, artabenefits.net. Artabenefits.net has a really great Build Your Benefit Plan tool. So if you click the Build Your Benefit Plan tool, this tool will ask you a series of questions of whether you are over 65, under 65, if you want travel, if you want dental. And from the questions that you answered, a chart will populate with all the different plans available to you, as well as those monthly premiums. Also on artabenefits.net, you can find your rate sheet. The Government of Alberta does have a landing page on the ARTA Benefit Plan website. And the rate sheet that you would be looking at is the public-private sector rate sheet. So go take a look at artabenefits.net. And start there and take a peek around and try to figure out a plan that works best for you and your family. That's all I have for you today. If you would like us to send you an enrollment kit, please email join@arta.net. And this enrollment kit will include our plan options brochure, a rate sheet, a guide to retirement, and some information about ARTA. So if you would like us to mail you one, just email join@arta.net. Send us your address and we can send you a physical copy, or we can email you a booklet as well. So just email join@arta.net. And we will send you all the information if you would like. I'll stick around for some questions that pop into the Q&A. However, if you don't have any questions, thanks for joining us today. We do have a really great YouTube channel where you can find some really great information on our benefits as well. But again, visit artabenefits.net to apply and to get some more information. I will type some of the answers to the questions here, or I will answer some of them live. There is a question for, do you provide any support for long-term care? With our benefits plan, we do have some options for private duty nursing, but we do partner with Chartwell. And Chartwell Residences, they offer our members some discounts for long-term care facilities. But with benefits, there is no benefit specifically for long-term care. However, we do offer annual maximums for private duty nursing. Okay, there is a question, are the benefit options provided to non-teacher members in a different way? The only difference with our public-private sector versus our education sector is the public-private sector rates are age banded. So when you do turn 75, your rates will slightly increase, and again at the age of 85. But the benefits are all the same. The benefit plans are all the same for our teacher members as well as our public-private sector members. Oh, there is a question. Some plans have travel maximums per incident, whereas yours is a lifetime maximum. So our annual lifetime maximum for emergency travel coverage is $5 million. Nobody has ever come close to reaching that $5 million lifetime maximum. I think the highest that we had come in was just over $800,000. However, on November 1st, our benefit plans maximum is changing a little bit. So stay tuned for that $5 million lifetime maximum. We will be increasing that in November, so just stay tuned. There's a question, does ARTA provide private duty nursing benefits for the comprehensive or build your own plans or for all options? All of our plans do include coverage for private duty nursing. In our comprehensive plans, it ranges from $1,500 to $2,500 a year for private duty nursing, and our build your own plans is $3,000 for private duty nursing annually. Please clarify, if you are a Government of Alberta retiree, not a teacher, your rates will go up at the age of 85. If you have a benefit plans that does include emergency travel coverage, your rate will increase at the age of 75 and again at the age of 85. A lot of plans will terminate you at the age of 85. So if you want a plan that still includes emergency travel coverage, ARTA will not terminate you at the age of 85. But it will increase, your rates will increase a bit at 75 and a bit at 85. So yes. There's another question. What is the monthly cost range of these plans? It really depends on what plan you are choosing. I can email you a rate sheet, which will outline all of the different rates for all of the different benefit plans if you would like. So just email join@arta.net and I will get a rate sheet to you this morning. There's a question, do you have other plans that would cover higher prescriptions in your group? The comprehensive plan, so the under 65, our essential health plan covers up to $5,000 a year, and that is our highest prescription drug maximum. By how much will rates increase when you turn 75 and 85? I think it's about 5%, 5 to 10%. I don't know off the top of my head, but I would be happy to send you a rate sheet this morning. There's a question. My wife is a retired teacher with single ARTA coverage. Can I join her plan? Absolutely. You would just need to fill out a plan change form, and then you can become a dependent on your wife's plan. And then you would move from a single plan to a couple plan. And in that couple plan, you each receive that annual maximum. So each covered person receives those annual maximums that I spoke about. Seems your coverage is better than Blue Cross when you retire. Yes, there are some advantages to joining ARTA. We always tell people, make sure you do your homework, but if you are wanting some emergency travel coverage, our plan is definitely a little bit better there. But I always tell people, make sure you compare plans and figure out which plan works best for you and your family. But I might be a little bit biased, but the ARTA Benefit Plan is a really excellent benefit plan that you can choose. There's a statement. My boss told me about ARTA. I didn't know before. How come we don't hear about this as lots would want this? I've been doing webinars with the Government of Alberta for about 2 years now, and I'm working really hard to try to communicate this to people. The Government of Alberta has been an amazing partner, and all of our information is, I think, on your benefits portal. So I'm really trying hard to get out there and let people know that if you are eligible to join ARTA, that you can join one of our benefits plans. So the GOA has been such an awesome partner. So I'm really trying to get the word out to everybody who is eligible. Tell your friends. Hey, don't see any other questions coming in, but please feel free to email join@arta.net. And I will get back to you as soon as I can. I know there was one question on here that I didn't really have an answer for, so I apologize for that. So just email join@arta.net and I'll make sure I get you the answer for that. I just don't want to give out any wrong information. So other than that, have a really great day. I'm doing this again this afternoon, so if you want to join again, feel free to do so.